So let's see how they do it in the Basque Country. If you look at them, this is the World Health Organization ranking. They do a ranking of which are the countries that are doing best as for offering health protection to their citizens. And Spain, the Spaniards are in number 7. Okay, they're really high. The Spaniards are doing really well when it comes down to protection of the health. France is doing really great. Italy and all those countries. Spain is number 7. It's really high. The U.S. number 35. Canada is number 30. They're not doing that great. When we look at this number 7, and we think about the Basque Country, and as I said, we have the financial autonomy, we do differently than the rest of Spain. We have our own system of health protection in the Basque Country that is separate from the system in the rest of Spain. So we could actually compare or bring the Basque Country out of here and bring it to positions around here. And let's see how they do it. Osakideza is an agency, it's a public agency that manages all the hospitals and health centers in the Basque Country. We're talking about a very small community, okay? We're only 2.2 million people, very small community. And we have our taxes, so we manage all our taxes for this small community, and this is how we do it. We have 18 hospitals, 309 health centers. We have 28 mental health centers. So if you lose your mind, you get a schizophrenia or whatever, you don't end up living on the street. And there are 24,000 people working in this organization to serve 2.2 million people. And it's kind of a pyramidal thing, and it's distributed in the 3 provinces individually, or something like that. So in each one of the provinces, this was the example of Guipúzcoa, we have a general hospital that is it would be something similar to San Francisco General, that is a university hospital where the new doctors are trained. So we have a general hospital, and then in each one of the counties, if the county is big enough and far enough for general hospital, we have another hospital. And then in each one of the cities, or if it's a little towns, or if it's a city, in each one of the neighborhoods of that little bigger city, we have health centers that provide basic family health for the people in that community. And then we have other, just a few pictures. So 3 general hospitals. This one is basically the biggest one because it serves the biggest community. It's el Hospital Universitario de Cruces, which is in Bilbao. Okay, so you guys can see the big building and all that, and very modern. I have to say, when I was doing the research, I learned, I already knew, but all these hospitals and like primary care and urgency care and all that, emergency care and all that, they got a lot of awards, like a lot of international awards for hugely high quality services. This is Hospital Universitario de Donostia. This used to be 2. I remember when I was a child, this was the municipal and this was the province one, and eventually they just unified everything and they call it Hospital Donostia, just that name. And there's another one in Araba, but I just didn't put a picture here. So 3 main hospitals, and then we have 15 regional hospitals. And you can see this cute picture with the snow and everything. This one is in Santa Maria. It's a pretty big hospital for a county if it's far away from Cruces, and they can do some, surgery or whatever. And they have another picture here, Hospital de Gorliz, this beautiful building as well. So it's kind of regional, but still a big kind of service. And then we have 309 neighborhood or small town health centers. So, wow, there's something happened with this picture. Okay, so this for example, it's in Eibar. So you can see it's kind of, in the middle of the city, they have a health center, similar to, there's stuff like this here as well, but all of this provides service to the whole community. Everybody who lives in that region, lives and work in that region, or not work, whatever, they get the protection of this umbrella. And this, for example, is in Gros, in Donosti, in San Sebastian. So I remember going here for some specialty doctors. We had in our neighborhood, we had a little one, and then if you needed to go to a specialty doctor or whatever, they would send you to a little bigger one. And I remember going there and getting some attention, whatever. So that's how it goes. And then we have the 28 mental health centers, because they want to make sure that the mental health also is covered. not only the rest of the staff. So it's really important. And then they have a lot of other kind of contracted services for cases of like, I don't know, if you're being like abused in your house, whatever, they have shelters or whatever, and houses, and other different situations. And those are usually provided not by the Basque government, but the provinces. Provinces have their own social services that provide all those services. And then we have other specialty things. I like this picture because they show the two blondest girls that they found in the hospital. They're like, you come here, we're going to take a picture with the doctor. Like all the Basques are that blonde. I love that one. But so this hospital is in San Sebastián in Donosti. Ursa is one of those, but now it's a bank, but it started as a public bank of the province. And so they get most of the customers when it comes down to banking in Gipuzkoa. So they have also a foundation and they do a lot of stuff with the community. One of the things that they purchased was this hospital that had been there for 80 years, and they were treating cancer cases, and now they are funding most of that.